Good evening and welcome to Chicago Tonight. I'm Brandis Friedman. Paris Schutz has the evening off. On the show tonight,
very productive conversations with the folks at CTU.
That's even as teachers threaten to not show up for work in person on Wednesday. The latest on negotiations from the CTU.
Vaccines are our most potent tool.
Not just for ending COVID, but also for closing systemic racial inequities. We've got specifics on Chicago's new vaccine distribution plan. Plus, the science behind the speed at which the COVID-19 vaccine was developed.
The effort is constitutional.
The article of impeachment heads to the Senate, what the Constitution says about impeaching a president after he leaves office.
2021, there have been 144 vehicle hijackings.
And that number is rising. Local officials share what's being done about this increase in carjackings. WGN America is changing its name. Find out the new moniker, plus other business headlines from Cranes. We talk with Metropolitan Family Services about why poverty can make victims of domestic violence feel trapped in an abusive home.
I'm Angel Ito, and tonight I'll have more from Montrose Harbor, where we're searching for beach class.
But first, some of today's top stories. Illinois officials say emergency crews are ready for tonight's heavy snow, forecast to be the worst in 2 years. Up to 8 inches of snow, hail, and freezing rain are expected later tonight and into tomorrow. The Illinois Department of Transportation has 1,800 trucks and equipment deployed statewide to plow, treat roads with salt, and respond to emergencies. State police and IDOT warn of longer travel times and deteriorating conditions and ask drivers to take it slow and make sure your gas tank is full. Two brothers accusing Father Michael Flager of abuse decades ago and who wish to remain anonymous held a news conference today.
I know what it's like to be wrongfully accused. I was a police officer. I understand people being wrongfully accused. I don't take that very lightly. And I'm not here very lightly. And I'm not here because I want to be. I'm here because this is the right thing to do.
What took me so long is because of his stature, how respected he is in Chicago. His name is always in some type of newspaper.
Father Flager has denied any wrongdoing. His lawyers released a statement today which reads in part, quote, "Father Flager has never abused them or anybody else. These allegations are false and are simply being made for money. This is a shakedown." One of the brothers sent a handwritten letter to Father Flager dated December 31st, 2020. The letter states, quote, "I am asking for a one-time payment to help me move on in this troubled and confused time in my life. I did not want to put a price, but I must. I am asking for $20,000 to be sent to my Zelle account." The Illinois and Chicago Departments of Public Health announced there are now 8 cases of the more contagious United Kingdom variant of coronavirus reported as of today in Illinois. Also announced today, there are nearly 3,000 new cases of COVID-19. There have been another 49 deaths. The state's total number of known coronavirus infections is now more than 1.1 million, and the statewide death toll is 18,798. And we'll have the latest on local vaccine distribution in just a few minutes. Chicago Public Schools officials and the Chicago Teachers Union continued negotiating over the weekend about teachers and staff returning to schools for in-person learning. The district announced yesterday it would push the return date to Wednesday in hopes of reaching a deal. Earlier today, Mayor Lori Lightfoot said she hopes such a deal is close.
In the course of this pandemic, there have never been any easy choices. There just haven't been. There's no easy choices now. And I think in partnership with the CTU, if we come together in good faith, I have every confidence whatsoever that we will get something done that obviously protects their members, but also gives families the options, if it's right for them, to be able to send their children back to in-person learning.
And joining us now is Stacey Davis Gates, Vice President of the Chicago Teachers Union. Welcome back, Stacey. So over the weekend, we heard Mayor Lightfoot and the district say that the district and school teachers, the union, were now, that you agree on more than you disagree when it comes to how to reopen schools. Do you agree with that description that we heard from the city?
I would agree that we still need an agreement for a safe return into our school buildings. As you know, Brandis, our members have been working since we went fully remote back in March. And so what we need is a safe return agreement. And right now we don't have the agreement. In fact, I left bargaining to join you. So we are still talking and we don't have an agreement.
And we thank you for stepping away so that you could talk to us just now, Stacey. But what do you need to hear from the district?
Well, today marked the beginning of 1B in the vaccination line. Our members are a part of 1B. We see in Deerfield and Skokie where the school district has worked hand in hand with the health department to offer their educators the first crack at it. They see them as essential workers, and they want to make sure that when they reopen schools, that their workers have a decent amount of protection going back in. That's not what we see here in Chicago. And our mayor is in control of the health department, as she is also in control of the school system. There should be greater, it should be a greater relationship between the two agencies to ensure a safe return to school buildings.
Now, in a letter to CPS families sent just yesterday, the district said, quote, students in over 130 private and parochial schools and over 2,000 early learning centers across the city have been safely learning in their classrooms since the fall. It goes on to say, we are pursuing this return because local, state, and federal health officials have made it clear that schools can operate safely with proper mitigations. Stacey, does the lack of major outbreaks in schools make you any more confident that CPS can provide a safe return to in-school learning?
So there's a couple of things here. One is language major, right? We know outbreaks are happening. We've seen them in over 60 schools since cluster students and pre-K students went back into the buildings. That's number one. Number two, the president of our great country has weighed in, and he said that we all deserve to be safe. Beyond that, you have a supermajority of the city council, local school council, over 100. And here's the biggest linchpin to this. We are a majority Black and brown school district, and the families have chosen to remain remote. This isn't simply about reopening. It is also about listening to people who have expressed great reservation about unsafe conditions and have requested remote learning. They've requested sustainable remote learning schedules. And I would like to end with this. The principals, only 17% of them are confident. So that leaves the overwhelming majority of building level administrators, along with our educators, along with our families, heck, along with the President of the United States of America, who are calling into question our ability to do this well. The least I think our mayor could do in this moment is prioritize vaccines like has been done in Skokie, has been done in Deerfield, and quite frankly, in the private schools here in Chicago.
So it sounds like obviously you'd like to see an acceleration of vaccines to teachers. Before we run out of time, one question that a lot of I think is on a lot of parents' minds. You know, CTU members have been demonstrating, doing outdoor teach-ins outside of your school buildings rather than head into the classroom. Parents are wondering, if you can't get a deal, are we going to see another strike?
No, if we can't get a deal, they've said they will lock us out. Our teachers have been very clear. Our clinicians, our paraprofessionals, every single person in our union says that they want to serve our students, right? And by serving our students, they want to log in. Right now we have over 100 teachers, some who don't even have students that are coming in person, who have been locked out of their virtual classrooms. We have to begin to prioritize. Listen, the very beginning of this reopening argument, our mayor said that this was about equity, that we had to get Black children and brown children back into buildings. Well, their family said no. And so right now, the question should be, why aren't we making virtual learning better and making that the equity that Black people, that brown people have already requested?
And Stacey, to that end, so earlier today, a group of Black CPS families, they did hold a press conference calling for a return to in-person learning. They say that Black students were already falling behind and the pandemic has just exacerbated that. Here's a little bit of what they had to say.
Black kids are struggling in this online learning environment. And when I'm explaining that, it goes on mute ears. no one is listening and taking that serious. There's a need for CPS, CTU to come to some resolution immediately so that our kids can be in the classroom.
Okay, so I think we may have lost the video there, but we could still hear that parent. Stacey, what is your reaction to that?
Well, a couple of things. Number one, she's not wrong. We were not meeting the needs of all of our students, which is why back in 2019, we were on strike for a school nurse, the irony in this moment. We were on strike for a social worker, the irony in this moment, right? And so what we are saying is that we cannot return to buildings the same way we left those buildings because they were insufficient then. To only have 4 school libraries on the west side of Chicago is a travesty. But juxtaposed to that, to return Black students, to return brown students to buildings that are ill-equipped to meet the grief, the trauma, and the mourning that they're dealing with in this moment is also inequitable. And quite frankly, it is cruel. Over the course of this pandemic, our members have engaged extensively in mutual aid, schools giving out tens of thousands of dollars in money and goods and groceries to help their families that they serve meet their needs. We get that on a very clear level, which is why when we're ridiculed for asking for things like rent abatement, for making sure that we have more social, emotional resources in our school communities, we don't understand. These are exactly the things that our students need in this moment. We should be wrapping our arms around the supports and prioritizing it for every student and their families in our school community.
Unfortunately, that is where we'll have to leave it. Thanks again, as always, for joining us. I'm sure we'll be speaking again soon. Thank you, Stacey.
Thank you.
It's another benchmark in the rollout of the coronavirus vaccine. Chicago has entered stage 1B. But what does that mean? And how do you sign up to get a vaccine? Amanda Venicky joins us now with a rundown of top facts about getting the COVID-19 vaccine. Amanda.
Brandis, the initial priority for getting the coronavirus vaccine was healthcare workers and also then long-term care facility residents and staff. Now, 6 weeks after the first Chicagoans received the coronavirus vaccine, it is opening up to millions more. Frontline essential workers like those who work at grocery stores or for mass transit, teachers and seniors, those over age 65. Mayor Lori Lightfoot, well, she's in her 50s, but she got the vaccine today. She is eligible as someone needed to keep government functioning. She used this as a platform to encourage other eligible Black and brown residents to also get the vaccine.
Unexpectedly low numbers of Black and brown Chicagoans have taken the vaccine so far. A percentage that is so alarmingly low that if we do not reverse this trend, we will continue to see more Black and brown fathers, mothers, grandparents, sons, daughters die of this virus when a vaccine is right here, right now, for free, for all.
According to city data, about 52% of those who have so far received the first dose of the COVID vaccine are white, 17% Latino, and 15% are Black.
We are falling woefully behind in a number of people of color who've been vaccinated to date. Those are numbers that simply cannot stand. And based on a recent survey by CDPH, those that are the sickest, meaning those that have the most severe underlying conditions, who need the vaccine the most, you are the most reluctant.
Now, that survey that she's talking about, this is a vulnerability index that the city's created, and it measures everything from the percentage of people living in poverty in certain areas, levels of health insurance, hospitalization rates, COVID cases. And then based on this index, it has chosen 15 communities that the city is going to focus on for its new Protect Chicago Plus program. And then these communities are going to get special attention and resources as the city aims to make sure that eligible residents of these communities in particular get the coronavirus vaccine. All of these communities that are under the Protect Chicago Plus program are where residents are primarily people of color. You can see on the chart on your screen, blue, the majority of residents are Latino, and those in purple, the majority are Black.
This does not mean that vaccine is not going to be available across the city. Of course it is. And as we move into 1B, as a very quick reminder, the top way people get vaccine is through their health provider. Check with your hospital, check with your primary care physician.
While on one hand, there are populations who are reluctant to get the coronavirus vaccine, others cannot wait. I have heard of folks continuously hitting refresh on their computer in an attempt to get an appointment. As Dr. already said, some people can get their vaccine through their doctor. Others might end up getting it through their workplace. Still others, yes, you can sign up for an appointment either at a pharmacy, local drugstore, or through your local health department. In order to do that, you may have to answer a questionnaire asking about age, your job, and health conditions. Should you get an appointment, you may have to show proof that you are eligible and of the appropriate age. But in places, it is going to take quite some time before that even becomes an issue. In Cook County, for example, 600,000 people are eligible in 1B.
However, we do not have adequate vaccine supply to vaccinate everyone immediately. So with this in mind, we're once again asking for your patience.
Still, the county is working with the state of Illinois to get a mass vaccination sites up and running. Preckwinkle herself got her first dose of a COVID vaccine today at a Tinley Park mass vaccination site. It's going to be opening tomorrow. The county's health director says everyone who wants a vaccine should go to Cook County's vaccine website and sign up.
So the website will only have, again, appointments for which we have vaccine, and we can guarantee if for some reason there's no appointments available, you are entered in queue. Every time we update the site with availability of appointments, you will get notifications based on that information. And if you're eligible at the time, so if you're at 1A, 1B, 1C,
1C in Chicago, that is when other essential workers, as well as those under the age of 65 with underlying medical conditions, will be eligible.
Our issue is we need more vaccine. And if we get more vaccine, we'll be able to accommodate everyone that wants it.
So 1C, not likely until spring. Officials keep on stressing, please be patient. Back to you.
Amanda, thank you. And of course, we'll have more on the COVID-19 vaccine later in the program, including a look at the speed at which the vaccine was developed. But before that, what the Constitution says about convicting a president after leaving office. Stick around. Good evening and welcome to Chicago Tonight, Black Voices. What do you believe prevents a strong coalition of Black and Latino communities forming across the communities?
I want us to, as a nation, to find a way to come together.
Go down the block, get it from someone local, and keep the money in the community.
Black joy and the Black experience is magical.
The article of impeachment charging former President Donald Trump has been delivered to the U.S. Senate. All 100 senators are expected to be sworn in as jurors tomorrow, and the trial will begin on February 9th. As Democrats and some Republicans push for the president to be convicted, others say it's unconstitutional for a former president to be tried after he leaves office. Joining us to talk about what the Constitution says about impeachment is Michael Kang, professor of constitutional law at Northwestern University's Pritzker School of Law. Professor Kang, thank you for joining us. So articles
Thanks so much for having me.
Absolutely. So articles of impeachment delivered this evening, though the Senate plans to begin the trial not until February 9th. And we know that once it begins, it has to continue, but does the Senate have some leeway on how and when this trial happens?
The formal rules of the Senate sort of contemplate immediate action and continuing through the trial until a decision's made. But in practice, they'll have the leeway that they want, especially in this case where I think the Republican side is pushing for a little bit more time. So I think they'll have flexibility to arrange the Senate trial the way they want.
And I imagine also in those couple of weeks, that means everybody's got some time to get things together for the trial. We saw that, last year's impeachment trial itself, it took weeks. Senators, sitting in attendance all day long. Now there's talk that for this one about splitting the day. The first part of the day would be for confirming President Biden's nominees, and then the other legislative matters, those would happen in the morning. But then the afternoon would be the trial. Is that possible?
I think it's probably possible. It's certainly different from the usual practice. It's hard to imagine the Senate conducting a trial of a former president and at the same time conducting its business at a busy time during an administration where they've got to get confirmation of presidential appointments through and deal with pandemic response, all of that. It seems like a lot to take on, but that's really up to them to decide. It's certainly not something that's decided by the Constitution or restricted by the Constitution one way or the other. So I think the Senate, again, has a lot of leeway to decide how they want to arrange their affairs in this case. It's really unusual, so it's going to take an unusual form.
Now, some have said that one way this trial might be quicker, that some Democrats say the senators themselves are the witnesses, meaning other witnesses would not need to be called. Is that even allowed?
Well, I think, again, really impeachment is one of these cases in the Constitution where it's entrusted to Congress to decide how they want to do things. And so there have been different types of impeachment trials, some with witnesses, some without. So I think in this case where Congress really has firsthand experience, they might not feel like it's necessary. But I think that's part of the negotiation that has to happen between the Senate side and the Trump team and maybe Republicans in the Senate. But I think it's certainly permissible. It's not specified by the Constitution one way or the other.
Now, part of the motivation for even having this impeachment for some Democrats, for most Democrats, some Republicans, is to convict the former president and therefore disqualify him from holding future office. But that would be a second vote after the vote to convict. A 2/3 vote is required to convict. But what is required in order to disqualify the president, the former president, from holding future office?
You're exactly right. So first, you need a 2/3 vote for conviction first. That is specified by the Constitution. That's one of the few things about impeachment that the Constitution specifically addresses. The Senate practice has been the subsequent vote on disqualification is by a majority. So that's what's been applied. I think there have been 3 federal judges that have been disqualified from holding office in the future, and that was taken to be a majority vote.
So on Fox News Sunday, Florida Republican Senator Marco Rubio said that a trial would only worsen partisanship. Here's what he said.
The trial is stupid. I think it's counterproductive. We already have a flaming fire in this country, and it's like taking a bunch of gasoline and pouring it on top of the fire. So that's a direct quote. The trial is stupid. But other Republicans say that since the former president has already left office, that a trial would be unconstitutional. Does the Constitution even say anything about impeachment after the president has left the office?
Yeah, the Constitution, again, just doesn't specifically address this. Those are 2 separate sanctions, one removal from office, one the other being disqualification from holding office in the future. That much we know. That's been the Senate sort of practice, and those are textually separated in the Constitution. So those are 2 different things. The first, removal from office, obviously that's a moot point, and that's exactly why Republicans are arguing it would be unnecessary because Trump's already left office. But I think the separate question of disqualification is still a live one because Donald Trump could hold office in the future, notwithstanding the fact that he's not the president right now. And in the past, there have been Senate trials even after a federal official has left office. And so there's certainly precedent for that. It wouldn't be the first time this ever happens. It's the first time it's ever happened to a former president as opposed to a judge that's left office or a cabinet member or something like that. But I think there are pretty solid arguments for going ahead. There's certainly now no constitutional prohibition on holding the trial, notwithstanding the fact that Donald Trump left office on January 20th.
Do you think this is something that's going to land in front of the Supreme Court?
Well, I think traditionally courts are really reluctant to deal with impeachment. This is understood as a quintessentially political question on which the courts really don't have much to say. So I think that cuts against court involvement here, against the Supreme Court jumping in. But Supreme Court is pretty unpredictable right now. And so it's hard to say. I think Donald Trump certainly sees the Supreme Court as his ally in some ways. And I think he thought even during the election process, or the post-election process, that his appointees on the Supreme Court were going to kind of bail him out and change the election result. So I would fully expect him, if he loses on disqualification, to try to litigate that and make himself eligible for office if he wanted to run again. I would be a little bit surprised, though, if it actually ended up before the Supreme Court and then they issued a decision overturning that. Lots
of questions, and I'm sure a lot to keep an eye on as this goes forward. Michael Kang, thank you so much for joining us.
Thank you.
WGN America is changing its name and focus. Chicago's second largest hotel faces yet another foreclosure lawsuit, and 2 suburban malls facing mortgage problems get a reprieve. But will the deal help solve their problems or just delay a reckoning? Here to go behind the headlines is Crane Chicago business editor Ann Dwyer. As always, good to see you again, Ann. So WGN America is changing its name to News Nation. Does that bring any other changes to its programming?
Yes, this is all part, Brandis, of a very interesting experiment that's been going on right here in Chicago, in which the old WGN America that WGN, which we've known all of our lives here in Chicago, is trying to put up competition to the existing national news networks. And the latest iteration of this is the rebranding of WGN America to this News Nation label that they're launching in March. In addition to that, they're going to be expanding their news programming by several hours. One of the most prominent moves that longtime WGN viewers will recognize is that Joe Donlan will anchor a 1-hour newscast at 6 p.m. each weekday. So again, it's going to be interesting to watch to see if they get traction against CNN, Fox News, some of the other round-the-clock cable channels.
Yeah, that should be interesting to watch. Now, last year we learned that the Palmer House Hotel is grappling with a $338 million foreclosure crisis due to the pandemic. But now the hotel is facing another foreclosure lawsuit. What's going on there?
This one pertains to the retail space at this landmark facility, Brandis, and it's a large retail space. I don't know when the last time is that you walked through there, but it's got 60,000 square feet of retail space in that very large building. And of course, in the pandemic, as we've discussed time and again, retail's really hurting, brick and mortar in particular. And Thor Equities, which holds this mortgage, at the Palmer House hasn't made payments on that mortgage since May. And so the lender has filed a $76 million suit seeking compensation for that. And as you noted, it is on top of a much larger foreclosure suit that was filed just a few months ago that pertains to the lodging and event spaces in that building.
Yeah, it's a big space. Sounds like a big problem. Also, 2 big malls, Gurney Mills to the north, Yorktown Center to the west of Chicago, getting more time to fix their debt problems. How bad of a fiscal situation are they in, Ann? And I apologize, we've got about 25 seconds.
Well, in brief, they're both in deep. These are, again, malls that really are struggling to draw clientele, especially at a time people don't feel safe to go. So in both cases, Gurney Mills and Yorktown, they've managed to work out agreements with their lenders for extensions. And I think we're going to be seeing more of that sort of thing across the retail landscape in the COVID and post-COVID eras.
And of course, we know malls were struggling before the pandemic. Our thanks to Ann Dwyer at Crane Chicago Business.
Thank you.
And still to come on Chicago Tonight, how the COVID-19 vaccine was developed in less than a year and why scientists say it is safe. We hear from an alderman, a police officer, and a community organizer about their efforts to defeat the spike in carjackings. A member of a local violence counseling program gives us a look at the ways poverty can make victims of domestic violence feel trapped in an abusive home.
I'm trying to spread the word of how humans are humans.
And how an artist is using his passion for reusable art to advocate for the homeless community. But first, Some more of today's top stories. Emergency crews are out in force for what's predicted to be the worst snowstorm in 2 years. Up to 8 inches of snow, hail, and freezing rain are expected tonight and into tomorrow. There are 1,800 Illinois Department of Transportation snowplows and emergency equipment deployed statewide to plow, salt roads, and to respond to emergencies. Father Michael Pfleger's lawyers are calling the accusations against him a, quote, shakedown after 2 brothers who have accused of abuse decades ago held a news conference today.
I know what it's like to be wrongfully accused. I was a police officer. I understand people being wrongfully accused. I don't take that very lightly. And I'm not here very lightly. And I'm not here because I want to be. I'm here because this is the right thing to do.
What took me so long is because of his stature, how respected he is in Chicago. His name is always in some type of newspaper.
Father Pfleger has vigorously denied any wrongdoing. Here's what his lawyers say in a statement, in part, quote, Father Pfleger has never abused them or anybody else. These allegations are false and are simply being made for money. This is a shakedown. One of the brothers sent a handwritten letter to Father Pfleger dated December 31st, 2020. The letter states, again, quote, I am asking for a one-time payment to help me move on in this troubled and confusing time in my life. I did not want to put a price, but I must. I am asking for $20,000 to be sent to my Zelle account. When Dr. Maurice Hillman set out to develop a vaccine for the mumps in 1963, it took only 4 years to go from the research lab to the doctor's office. That record of 4 years was broken in 2020 when it took less than a year for pharmaceutical companies to successfully develop vaccines for COVID-19. The unprecedented time frame has left some questioning whether a vaccine developed in such a short time could really be safe. Joining us to talk about the speed behind the vaccine, or the science behind the speed, are Dr. Emily Landon, Executive Medical Director for Infection Prevention and Control at UChicago Medicine, and Dr. Robert Murphy, Director of the Institute for Global Health at Northwestern University's Feinberg School of Medicine. Doctors, thank you for joining us. Dr. Murphy, let's start with you, please. You know, you say it was possible to create a vaccine so quickly because science had a couple of head starts. The existing vaccines for SARS and MERS, and the Chinese sequencing the virus in January. Explain how all of that worked.
Well, we had the tools available to actually do this. And what happened was we already had a vaccine for Ebola and for MERS, 2 other coronaviruses. So there was a step ahead right there. We have the technologies available. And critically, what we had was scientists jumping on the problem. And then BARDA, part of the US government, actually infusing these promising companies with literally billions of dollars, pre-buying vaccine before they were even really developed. And this combination of funding, the technology that already existed, and the experience with other coronaviruses is what shoved this thing through so quickly.
And Dr. Landon, why did vaccines used to take so long, and what's different now? How is that different now?
First of all, I apologize for the dog barking. He was super quiet until we came on
Until
here.
right now.
Yeah. Previous versions of vaccines required us to grow the pathogen, the virus, in cell culture and then somehow inactivate it. You'd have to purify it, maybe pull the proteins out of it and mix them up and make them into a mixture that you could give to patients as a vaccine. That process is different for every single pathogen, and you have to work through how to figure out how to grow it, just like a gardener might have to do a lot for plants. And that does not have to happen here because they literally just take that sequencing data and sort of stick it in to this it's a cookbook type recipe thing for this messenger RNA that makes a spike protein, and that can be modified pretty quickly. These vaccines are old. They've been tried for 20 years now for lots of different diseases with these messenger RNA vaccines, and lots of people have gotten them in trials. They didn't cause any side effects or any problems, but they also didn't work. It's really remarkable that they worked so well, and we're so lucky that they work so well for this virus.
And Dr. Murphy, you know, Dr. Landon just explained a little bit about the mRNA, the messenger vaccines, and how those work. But how long has that technology been around, and what else is it used for?
Well, it hasn't really been around all that long. As far as vaccines are concerned, in the infectious disease field anyway, this was relatively new. And, RNA viruses are very small, they're fragile. And what Dr. Landon was saying, it ended up being a molecular construction project rather than trying to grow in any kind of human cells or crush the virus, whatever. So it was a new technology, it was a gamble. And as you can see from the results of these first two products that were released in the United States from Pfizer and Moderna, it really paid off. I mean, the efficacy rate in preventing disease of basically 95% was way beyond anybody's expectation.
Another concern that we heard, Dr. Landon, people being worried that the testing period was not long enough to determine any adverse or unexpected side effects from this vaccine. How long was the testing period for this, and was it long enough?
So they did about 2 months from the second dose of the vaccine in order to determine whether or not it was going to protect people from COVID and that it was going to be safe enough. Now, what's important to know is that while there have been some long-term bad effects of vaccines in the past, all of those start within the first 6 weeks after the dose. They don't start 10 years later. They may last, and some bad vaccines have happened in the past, but everything started early. And so the fact that they did a 2-month time period gave us all the information we needed to tell us that it worked to prevent COVID, but it also told us that nobody was experiencing anything that was going to ramp up to a long-term side effect. And the previous experiences with these mRNA vaccines, where they tried them for other types of viruses, helped us to know that there weren't long-term effects in any of the animal trials or any of the previous human trials as well. So we know this type of technology is safe.
And there's also, a difference between the side effects and the effects of the vaccine doing its job.
Yeah, so the side effects, oftentimes we think that when we feel bad after we take a medicine, it's because there's something in the medicine that doesn't agree with us, or maybe there's a preservative or a chemical in there that's bad. That's not what's happening here. People do feel kind of sick after their dose. I felt pretty sick for about 12 hours after my second dose, but that was because this vaccine is so good at getting your immune system to really practice fighting off the COVID. It presents it with that spike protein and it says, go to it, and your immune system gets a lot of good experience. And that's what makes you feel bad when you have a cold or the flu. It's not the flu that gives you a fever and chills and muscle aches. It's your immune system fighting it off. And so when we get that after the vaccine, it makes us happy. Now, people who don't have such severe side effects, which is more than half the people that get the vaccine don't have any side effects at all, they get the same immune response. So there's no need to worry if you don't feel sick. But if you do, it's relatively mild and it doesn't last that long. And it is, I think, worth it.
And Dr.
Another reason why, if I could just add that this trial went so quickly, these trials, multiple trials, and we're talking about 30,000 people per trial at a minimum, is that we're in the middle of a pandemic. There's lots of patients, there's lots of disease. And so that, coupled with what Dr. Landon just outlined and what we've been talking about, really was why this thing, they got all the endpoints very quickly and they could make a decision.
Okay, my thanks to Dr. Emily Landon and Dr. Robert Murphy for joining us and breaking it all down. And after a surge in carjackings last year, Chicago has seen more than 160 carjackings already in 2021. The Chicago Police Department says it's taking a more comprehensive approach to deal with the spike, like adding detective staff and expanding the citywide carjacking task force. Some community members are also working to stop this trend, forming watch groups at gas stations. Joining us with more about these efforts are Steve DeJoie, a community organizer putting together a watch group in Hyde Park to prevent carjackings, 39th Ward Alderman Chris Taliaferro, who is also the chairman of the Committee of Public Safety, which will discuss carjackings tomorrow, and the Chicago Police Chief of Patrol, Brian McDermott. Gentlemen, thanks to you all for joining us. Alderman Taliaferro, I want to start with you, please. Your ward is experiencing a lot of these carjackings. What are you hearing from residents?
Well, I think, overall on the west side of Chicago, my constituents, just as, on the south side and throughout the city, are very concerned. And I think most important, they want to know how to stay and how to remain safe and how to ensure that their neighbors are safe as well. And so we've been fortunate to be able to work with our Chicago Police Department and getting their plan out so that our residents can feel much safer.
And as you're speaking of this, I just want to let our viewers know this is a heat map that we're looking at, basically where a lot of these vehicular hijackings have been happening. Steve DeJoie, you formed a watchdog group in Hyde Park at a gas station last weekend. How did that go?
Well, it started because the proliferation of carjackings in Hyde Park has just grown exponentially in the last couple of months. And so as we saw that the crime was escalating, we wanted to at least establish a couple of hours of safety for residents of Hyde Park of all, women, men, and children as well. But most importantly, we thought it was important to establish at least a safe zone for a couple of hours on Saturday from 11 to 1, so that on that day, when a lot of people get out in the morning and fill up their cars and start their chores and start their errands, they can come with safety and fill up. So we're not there to apprehend, we're not there to interrogate, we're there to observe, and of course intervene safely if necessary, and then report any threat that we might see that we can report to the police department.
And Steve, sticking with you for just a second, how have you seen Hyde Park be affected by this increase in carjackings?
You know, I can tell you from the response we saw with women that were coming to the pump on Saturday, they are beyond concerned. They are in terror. You know, several women stopped in to get their gas once they saw that we were gathered there. And they said literally that they were about to run out of gas, but they were so scared to pull into a station and be vulnerable. So what we decided is that community over disunity, and you know, they will see a weapon on a security guard and not fear that. But when they see community gathered in safety, they will pass that station up and go to another spot. So hopefully what we do is we deter some activity, and then create awareness about the situation. A lot of people just don't know what to do in the case of a car check.
Right. So last week, the police department released video of a carjacking that happened near Willis Tower that we're looking at right now. Chief McDermott, how is the department handling these crimes differently because of this increase?
Well, like you said in the lead into the segment, we do have a comprehensive approach now where we have 4 independent strategies. One of them being a law enforcement strategy, in which we have a coordination of our resources, between the Bureau of Patrol and the Bureau of Detectives. Not only that, but we have, we're ensuring proper information sharing between the bureaus and with neighboring districts, not only with neighboring districts, but with the surrounding suburbs as well. The second part of that independent strategy is working with our prosecutors to coordinate our resources to build stronger cases, and utilizing special prosecution. We want to work with all of our partners on a prosecution side, including the Cook County State's Attorney's Office, our judges, the juvenile court system, our federal partners. In addition to that, the third part of the strategy is our youth intervention side, in which we're utilizing all the tools that we have available. CPS has its own strategy to get out to youth. We have our CAPS program. We're utilizing our neighborhood policing initiative and our DCO program, which is our district coordination officer program, to make sure that these youth have the tools that they need to make proper decisions and to get out of the life of crime. But at the same time, we have to let them know that, there's going to be consequences for their action through, prosecution and arrest. And, the fourth part of our strategy includes a public engagement strategy where, we're trying to get a top-down message from the department out to all the residents of the city of Chicago. And that message we want to get out through our social media accounts, our Facebook pages,
and
Twitter accounts, through news affairs, and through this message we want to tell everybody things to look out for, safety tips, things that you could do if you're a victim of a crime.
And Chief, I want to come back to that in just a little bit about what people can do to stay safe, hopefully. But just last week, Superintendent David Brown, he talked a little bit about the cause, but he spoke about the increase in carjackings. Here's what he said.
The spike in vehicular carjackings are a regional and national issue that both urban and suburban cities are experiencing across the country. Motives include joyriding and to facilitate anonymity while committing other crimes, to include robbery and shootings.
Steve DeJoie, what role do you think the virus has played in this increase in motives?
This was occurring long before the COVID virus hit. It's an impact of not only poverty, the civil unrest and the political activity that we've seen in the country. I think it's all a combination of several factors, but certainly the desperation of COVID has an impact on it. But these kids just need to learn this is the wrong thing to do. It's illegal, and it has consequences that will affect you for the rest of your life. You know, just tonight, a young man, 15 years old in South Suburban Harvey, I believe, was killed while he was attempting to carjack someone else in a shootout ensued, and he was a liability and murdered in the shooting. So, you know, this has to stop. It has to come with a two-pronged approach with the police department. Chief, I really applaud what you just said, and I'm happy to be a part of that with you because, you know, Twitter and Facebook and social media is fine, but at some point we've got to get out and stop pointing fingers and grab hands, hold hands together, and work to make our community safe.
To that point, Alderman Taliaferro, there seemed to be some dispute between aldermen last week on whether or not this is a matter of law enforcement or fixing inequities. In a very brief amount of time, Alderman, how do you think this should be handled? I apologize for the brevity. Uh-oh, it looks like you're on mute, Alderman Taliaferro, so that means we'll have to follow up on this story another time. Okay. My thanks to Chief Brian McDermott, Steve DeJoie, and Chris Taliaferro. Thanks to all of you for joining us this evening.
Thank you, Randy. You guys have a good day.
Thank you for having us.
And the U.S. Census estimates that 1/3 of Chicago's Latinos, the majority of them women, are living in poverty. And while we should be careful to note that victims of domestic violence are not exclusively women, the great majority are, and their advocates say that poverty can trap women in an abusive home. And in the Latino community, language barriers and immigration status can make matters worse. As part of WTTW's First-Hand initiative exploring poverty in the Chicago area, Chicago Tonight is taking a monthly look at some of the multitude of issues surrounding poverty. In a conversation that first appeared on Chicago Tonight Latino Voices, WTTW News Director and host Hugo Balta spoke with Leticia Guitron. She's a clinical program supervisor for the Domestic Violence Counseling Program at Metropolitan Family Services Midway Center. He began by asking Guitron whether she thinks people living in poverty are more susceptible to domestic violence.
Absolutely, yes. So I wanted to make sure that I say this out loud, that poverty definitely it's a huge factor as far as domestic violence goes. But I want to make sure that everyone knows too that poverty doesn't cause domestic violence. When I think about the impact of poverty on victims of abuse, I think about the financial resources and the lack of those resources to survivors. So oftentimes we see that there's only one income in the family. We see that survivors depend completely on their financially on their partner. We see that perhaps there's a huge rate of unemployment where there's no job skills, or we see that there's no work experience on survivors and victims of crimes. Yes.
Leticia, let's talk a little bit about religious. Many Latinos have religious upbringings and traditions, and you can say abusers can use faith as a tactic to control. Can you explain how that might happen?
Yes, absolutely. So religious is a huge factor used to control and manipulate victims. So oftentimes the religions see the divorce or separation as something wrong, something that should not be happening in the families. Also, in Latinos particularly, I hear clients who share how the religious affiliation oftentimes tells them that that's their esa es su cruz. So the abuse and the situation at home is pretty much the cross that they have to carry in order for them to make things work in the family.
Let's talk a little bit about undocumented immigrants. Are they more at risk of abuse by family members?
There's definitely an impact on or a greater risk for those who are undocumented. So thinking about our clients. So one thing that we see is how the legal status is actually used to further perpetrate the abuse because it's used as a tactic to control and manipulate the partner by either making threats that ICE is going to be called on them and they're going to be deported and they're going to lose their kids. and or when there are threats that the police is going to be called and they're going to be incarcerated, and survivors are going to be incarcerated because of their legal status.
Be it documented status, be it cultural issues, economic issues, how can people who are living in poverty and experiencing domestic abuse get help?
They can actually receive help by reaching out to community organizations such as Metropolitan Family Services. I know that oftentimes it's the lack of knowing what's available out there for those individuals who are going through domestic violence and or who have limited resources. But it's really important that we can continue to spread the word and educate those and try to reach out to those in poverty to let them know that resources are available and there are organizations that can support them in the process of either leaving the abusive relationship or trying to find a way to increase their safety.
Many of the members of the undocumented community, immigrants, language is a barrier. Are there resources available to people who do not speak English?
Absolutely. So I can speak for Metropolitan Family Services. So we do provide services in Spanish. So it's really important that the community identifies different organizations or that actually can provide the service in Spanish. So speaking of Metropolitan Family Services, we are very fortunate that we can provide services in both English and Spanish. So as a matter of fact, the Midway Center, which is the center that I work in, we do serve about 80% of our clients in Spanish. And the services that we provide are trauma-informed care, and definitely they're offering Spanish to both adults and children based on their preference.
Leticia Guitron, thank you so much for your time and for your insights.
Thank you so much for the opportunity to be here.
Back with more Chicago Tonight right after this.
A Chicago artist is working to bring awareness to the homeless community through his artwork, one sculpture at a time. Arts correspondent Angel Edo recently brought us this story. Here's another look.
All the pieces of sea glass I find, they're survivors. They're the toughest little bits left.
For Zach Lowing, the hours he spends scouring the beach for reusable glass is about more than the sculptures he turns them into. It's through this platform that he hopes to bring attention to the homeless community.
And I kind of like that idea that they're survivors because, I've been homeless. And some of the greatest people I've met are those survivors. The people that tough it out through unimaginably hard times. A lot of what I do, I guess, is to help people see that the homeless, there's more to them. These days, the homeless are like the furthest point on the marginalized people.
Lowing has been out of work for about 4 months now and spends some of his time making sculptures out of beach glass.
Lately, I've been concentrating more on the browns and greens because I just love the way they look. Anytime I find or see cobalt blue, I pick it up no matter what. You gotta do that, But you also find like milk glass, which is like a pale white. I'm not sure what to do with it yet. You'll find chunks of glass that are like that thick, which I'm not sure what they were, maybe on a boat, like heavy duty glass. And then you'll find Parental lens glass, which has got all the little ridges on it, which eventually I want to do something with that. That'd be really neat. You'll find safety glass with the little wires going through it, and the ends will be rusting inward. It'll leave like a neat pattern on the glass. And on occasion, you'll find what I call shatters. It's a piece of glass that was in a fire, but then they hit it with water, and it shattered, and it looks like a puzzle. It holds together. It's smooth, but it looks shattered. It's beautiful. It's very rare.
We visited a landfill near Montrose Harbor to see where he finds his material.
So these are a lot of frosted pieces, which is why they're not as transparent. But it's so beautiful.
For collectors, these frosted pieces are the most sought after. But Lowing says he loves transparent glass the most.
Because I'm interested in the way that the light transmits through all these things. You can look at them through your hand and at the light, but with the LED lights, they don't get hot. So it works really well with it.
Lowing says he'll continue to make these sculptures even after he's found work, because for him, it's about the message behind the art.
You gotta help them understand, you gotta plant seeds. And nobody likes an angry man, especially an angry homeless man. I understand that. And so I try to speak out for those people, because I'm not homeless right now, but it's kind of a scar on your body, on your system, on your soul, much like any other traumatization that might happen in your life. I'll always be at risk.
For Chicago Tonight, I'm Angel Ito.
Zach says he hasn't been able to hit the beach for more recycled glass in about a month, but he has created 25 new sculptures since this story first aired. You can visit our website for more information on how to purchase his work. And that's our show for this Monday night. Don't forget to stay connected with us by signing up for our daily briefing. And you can get Chicago Tonight streamed on Facebook, YouTube, and our website, WTTW.com/news. You can also get the show via podcast and the PBS video app. And please join us tomorrow night live at 7. A look at what President Biden's foreign policy may look like. And former longtime Tribune journalists reflect on their careers and the future of the news business. And tonight, in just a few minutes, join Latino Voices host Hugo Balta for a community conversation. He'll be joined by community leaders and health professionals to discuss COVID-19's impact on the Latino community. They'll also answer questions about the coronavirus vaccines. Again, that's tonight at 8 p.m. You can visit WTTW.com/events to RSVP. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a Chicago personal injury and wrongful death firm, sponsoring a free continuing legal education program for over a decade for lawyers across the state.